The Ashgrove Clinic is probably one of the biggest clinics in the Midlands in terms of the range of therapies available.
My name's Claire Short and I'm one of the co-directors and one of the osteopaths at the Ashgrove Clinic.
I'm Stephen Bruce, I'm the director of the Ashgrove Clinic in Higham Ferrers, which is a centre of excellence for a variety of complementary healthcare practices.
I love osteopathy. I think it's great.
The human body is really good at fixing itself, but sometimes it just needs a little bit of a nudge so that it can get on with it. And I suppose what we're famous for cracking joints, which is no different to popping your knuckles, but the purpose of this is to get the joint moving more freely.
I came to Claire's open garden one time, realised there was an osteopath on the doorstep. Magic.
You look at the entire structure of a human being and you see that problems with the neck can be caused by problems with the pelvis or in the feet, and that knee problems are just part of all of that picture. So it's looking at the whole picture of a human being, which is really exciting.
It's the relief when it's all over. That's all that's all I want, is the relief, and I can carry on a normal life,
It's based on 5 years medical training. We understand the pathologies behind people's illnesses, which means when we come across something which isn't amenable to manual therapy, then we can refer to a specialist or a general practitioner if necessary.
Some of the things that people don't realise we treat are arthritic pain.
We get neck pain, we get headaches,
foot problems, sprained ankles,
muscle strain.
We treat frozen shoulder and have a specialist clinic here for frozen shoulder.
Golfer's elbow, tennis elbow.
RSI issues and of course back pain.
All these things are amenable to osteopathy.
The youngest person I've treated is 5 days old and the oldest person is 94. So we cover everybody.
I would say that I can walk better. My posture is a lot better and I have more freedom in my arm movements and in my back.
It's very, very satisfying to have a patient limp in with chronic severe back pain and then to have them either walking out without pain after the treatment or at least considerably better after the treatment.
I had a sneezing fit one Sunday morning and on about the fourth sneeze my back just seemed to go. It was like being paralysed, stuck in a chair, and couldn't walk or nothing for about 4 days. Then I went to the Ashgrove Clinic, saw Stephen, he'd done a few clicks on me, and then that was it, I could walk again. It was like, I couldn't believe it really.
It gets people back to work earlier, it makes people's social life, domestic life that much better. You see happy people walking out of the clinic, and that's very rewarding.
Well worth having it done.
Having the physiotherapists, the counsellors, the hypnotherapists and the acupuncturists, as well as the massage therapists, really make us much more rounded and mean that we can help far more people.
I brought my 12-year-old son here for cranial osteopathy and I was very happy with the way Claire dealt with him.
Cranial osteopathy is a really gentle way of treating. It's not just restricted to the head. Cranial osteopathy can be used on the whole body.
And I was really happy with bringing him here. It was very safe, it was a very caring environment to bring him into, and he really enjoys coming.
That's what I don't ever understand. They seem to know where it's hurting without you actually pointing to the spot. You think, that's sorted that out.
We're a private healthcare clinic, so anyone can call us and book in, and we guarantee that we will get you in to see either an osteopath or a physiotherapist within 3 days.
We're very privileged in that we have half an hour to spend with our patients. Most medical professionals don't have that time to listen and to understand what's happening with the person who's in pain. And I think that's a real advantage for us, that we do get to understand exactly where the pain is coming from and what's happening to that body.